Hi everyone, today we're going to look at record keeping and helping you to prepare for placement. So there are some activities for you on Blackboard and this is to go alongside those, just a bit of theory to help you prepare. Okay, so the aims and objectives is basically to explore the legal and professional responsibilities of a nurse in relation to documentation, to explain the responsibilities in relation to the Code of Conduct, to explain issues of confidentiality in relation to nursing documentation, and to identify key components of accurate, meaningful nursing documentation. So in practice, you will see a variety of different methods of communicating of different healthcare records. It might be the traditional handwritten clinical notes in somebody's patient file. It might be the observation charts, specifically the Qs and the News 2 score. It might be letters between different healthcare professionals and social care professionals. It might be emails. It could be laboratory results and reports or blood gas findings. It could be an x-ray, a video or a tape recording. It could be a photograph, for example, a photograph of someone's pressure sore or someone's injury. It could be a printout from a monitor. And nowadays there are lots of electrical formats. Depending on the trust you work, you'll see lots of different computer systems. You might come across System 1, which is a method of keeping patient records in general practice and also some hospitals. You might come across Lorenzo, which is a mechanism of providing laboratory results. You might come across Metavision, which is used in critical care in some trusts. So there are lots of different electronic formats, and we don't expect you to know them all. But your notes, no matter which method you're using, you are accountable basically for what you document. Your notes show your decision-making process. It shows how you supported the delivery of services. It supports effective clinical judgments. It supports patient care and communication, and it makes continuity easier. Most importantly, it safeguards you. We always say if it's not documented, it didn't happen. You must document everything. You must have accurate documentation of the events during the shift that you've been working. It also promotes better communication and sharing of information between members of the multidisciplinary team, so it improves patient safety and it helps to identify risks and enable early detection of complications. So think of your Waterloo chart, your moving and handling assessment, your head stocking assessment, your falls risk assessment, your must assessment. There are so many pieces of documentation we complete, and many of those will help us to identify risks and prevent incident and injury. I don't know if you've come across the term chain of error, but if your documentation is inaccurate or it's a bit ambiguous, then potentially it can be the start or part of a chain of error and it can cause harm to your patient. So you have to be really careful when writing your documentation. The NMC says that we've got official responsibilities as a qualified nurse. As a student nurse, everything that you document must be countersigned by a qualified nurse because they are accountable um, for the acts and omissions during their shift when they are managing that patient's care. Okay. So keep clear and accurate records relevant to your practice. To achieve this, you must complete all records at the time or as soon as possible after an event, recording if the notes are written sometime after the event. So we just write written retrospectively and what time it actually happened. Identify any risks or problems that have arisen and the steps taken to deal with them so that colleagues who use the records have all the information they need. Complete all records accurately and without any falsification, taking immediate and appropriate action if you become aware that someone has not kept to those requirements. So if you, for example, saw somebody signing that they'd given a drug and they'd not given it, or if you saw someone documenting that they had done something and they had not done it, then you would need to escalate this to your practice supervisor. Okay, the patient could be at risk. You must attribute any entries you make in any paper or electronic records to yourself, making sure they are clearly written, dated and timed, and do not include unnecessary abbreviations. So think about activity 1, jargon or speculation. Take all steps to make sure that all records are kept securely. Think about data protection. And collect, treat and store all data and research findings appropriately. So think about confidentiality. As a student nurse, you must ensure that all your entries are countersigned by your mentor or practice supervisor, depending which cohort you are, or the staff nurse you are working with that day. Follow local policy on record keeping, data protection and confidentiality. And remember your code of conduct and the principles attached to record keeping. Let's think about confidentiality for a moment. So everyone that works in the NHS is bound by a legal duty of confidence to protect personal information they might come into contact with during the course of their work. We're in a really privileged position that we are privy to some very private information about people and their health and well-being, and we have to keep that in confidence. We have a duty of confidentiality, okay, and that is law. Patient confidentiality is legally protected under the Data Protection Act, Common Law of Confidentiality, and the Human Rights Act, and the NMC Code. Patients can informally look at their healthcare records, but this has to be arranged beforehand. So if you saw, for example, a patient or a relative picking up their notes and looking at them, actually they are required to request this beforehand. They can't just do that. Those notes are private and confidential. And if they're required for a specific reason, such as a complaint, they have to request this under the Data Protection Act or the Freedom of Information Act. So best practice. When undertaking written documentation, write in black ink. Document as soon as possible. Be clear and factual. Does what you have written make sense? Show that your duty of care has been honoured. Sign, date and state your role in every entry, and as a student nurse make sure it's countersigned. Don't use Tipp-Ex or scribble an entry out. Draw a neat single line through the entry, sign and date it. And don't make humorous entries. These do not stand well in a court of law. You need to document any discussions that have taken place. So if you have spoken to the patient about something, or the relatives, the family, the carers, or there's been a telephone inquiry about them, or a member of the multidisciplinary team, briefly document that discussion so that everyone else is aware of it, and that allows continuity of care and patient safety. Include clinical observations, blood pressure, temp, etc. It adds to the decision-making process. And on that point, I'd say be clear. You'll sometimes see people write things like, the blood pressure was in their boots, or things like that. Their blood pressure dropped significantly. Well, what was it and what did it drop to? Okay, is that normal for them? The temperature, actually say what the temperature is. Don't say, oh, they were really cold or they were really hot. What was the temperature? So be very specific. Be consecutive. Document consent. So, today I changed the patient's catheter. Consent was obtained and the procedure was explained. Keep abbreviations to a minimum. Okay, different people will use different abbreviations. For example, if you're a nurse, TWOC is trial without catheter. If you were a police officer, it would be taken without consent in a incident with a car. So, and there's multiple other examples just within nursing where the same abbreviation means the same thing. So keep to a minimum, write the proper terminology. Left and right must be written in full, not L or R. Discard any handover sheets as per hospital policy. Okay, shred it and get rid of it. I can remember working with someone who constantly used to go around trying to get handover from the other nurses and leave the handover sheet in various places when she went off to do other jobs. And patients and families would come up and say, "Oh, I've just found this. It's got private documentation on it, so you must discard the handover sheet and shred it. Okay, do not take it home with you." And as I said before, if it's not written down, it hasn't happened, and you need to remember that. Okay, these are some examples of sentences that have actually been found in nursing documentation. Have a think about these and see what you think. The patient had been acting funny all afternoon. When she fainted, her eyes rolled around the room. Occasional constant infrequent headaches. Patient was alert and unresponsive. The baby was delivered, the cord clamped and cut, and handed to the paediatrician, who breathed and cried immediately. They're very vague, aren't they? I'm sure you can just about make out what the person was trying to say, but they're not very good, are they? Don't be the person that writes something like that. Okay, now these are some more examples. I don't think you would see things like this nowadays. These are probably more historical, but these are examples, embarrassingly, of things that were written in patient care plans in the past. Okay, these are very embarrassing. I personally haven't seen anything like this in a care plan, but historically, these are things that you might have found once upon a time in a care plan. It's not good, it's not professional, and it's not, it's not objective. It's not good. So don't ever write anything like this in a care plan. Okay, so we've given you these activities as an aside from the PowerPoint. So these will be on your Blackboard site. So just have a look in a moment. Adverse events. Communication and staff attitudes were a factor in almost half of NHS complaints in the last year. Verbal communication, such as handovers, are just as important as written documentation. Think about safety huddles and things that we've seen come to the fore in recent years. Verbal communication and staff updates are very important. The quality and accuracy of written documentation was highlighted in 35% of all complaints made. Inaccurate or ambiguous documentation can potentially start or be part of the error chain. Poor documentation can cause harm to patients if we don't update care plans. We fail to carry out assessments, and worst of all, we fail to escalate the deteriorating patient. So when might records be required? By a patient applying for access to their medical records under the Data Protection Act, by the patient's solicitor for a litigation claim, by the patient's solicitor for a clinical negligence claim against the trust, or by the patient's solicitor in support of a clinical negligence claim against another trust. Okay, these are serious situations, and your documentation will be used. Obviously, we need to mention that there have been a lot of changes in recent years to nursing documentation. It's not necessarily all on paper anymore. It's often digital, electronic documentation, but we need to treat both just as seriously. Sometimes now you might find that data is kept on a smart card, recording of permission to access and share interprofessionally, access controls, audit trails, consent, encryption of documents. Okay, so try and use words properly. Look at these pictures and just use these as a final thought about what you document and how you communicate. Okay, thank you very much.